The AC or acromio-clavicular joint is a joint between the end of the collarbone and the tip of the wing bone. It forms an apex at the top part of the shoulder. It's an important connection between a free-hanging mobile limb and the rest of the axial skeleton. The ligaments that hold the joint together can be damaged, often from direct trauma such as a fall onto the point of the shoulder. A grade 1 injury involves the ligaments of the AC joint and it is stable. Grade 2 involves additional disruption to the ligaments that hold the collarbone from lifting up, where a grade 3 injury is complete disruption of these ligaments, where the joint can become unstable. There are other grades that are much more complex. Most of these injuries do not require surgery, but they can lead to long-term problems with shoulder function, and an individual assessment is recommended to guide best management. In some cases, the disc inside the joint that normally cushions it will degrade, and the joint will become arthritic with a loss of cartilage, formation of bone spurs, and these bone spurs can then lead to rotator cuff wear and pain. Depending on their activities, most people with AC joint osteoarthritis won't have significant symptoms because it's quite a stable joint. In fact, one recent study showed that 90% of patients who had asymptomatic AC joint osteoarthritis that was seen incidentally on an MRI for other shoulder issues stayed symptom-free for 7 years. Weightlifter's shoulder or distal clavicle osteolysis is a condition that tends to be quite consistently painful and can be very debilitating. This is where the outer end of the collarbone becomes painful and the inner structure of the bone, or the trabecular bone, starts to break down. It looks like this moth-eaten appearance on X-ray. It's really a kind of bone stress injury that happens in people who overload the shoulder in the horizontal pushing and pulling plane. And once it's set in action, there's very little we can do to reverse it. As with other bone stress injuries, the body has to remove and resorb all of the old bone before it lays down new bone. However, the resorption phase seems to be continued unopposed for months, and it's thought that this is related to issues with the limited blood flow in this area of the body. What we see clinically is a very warm, tender edge of the collarbone and this moth-eaten appearance of the end of the clavicle on X-rays. On MRI, we see a lot of bone bruising. The symptoms of osteolysis of the distal clavicle tend to last 6 months or more, which is very limiting for people who enjoy strength training, as even light daily loads can lead to severe aggravation of pain. First-line treatment includes rest, possibly a corticosteroid injection, especially when there's a lot of night pain. Other conservative treatment options that are more experimental, targeting the excessive and prolonged phase of bone resorption and blood flow to the bone, do exist. Surgical treatment involves resection of the tip of the collarbone via a keyhole surgery, and this is highly effective with over 90% of patients satisfied with their surgery. It leads to a rapid recovery over a couple of months, and this is certainly better than we see with most other surgeries, but generally most patients will be asked to wait a minimum of 3 to 6 months to ensure the condition has stabilised.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.